Hi, Doc. I wanted to talk to you today about an article that I recently read that said hearing loss can actually have an impact on the health of my brain. Is this true?
Um, there's been a lot of talk and a lot of publication, a lot of attention to the relationship between hearing and brain health. When we talk about brain health, we're talking about so many different things that affect our brain health. One of those things is good hearing. And the reason why it's important is because as we age and as our brain starts to age or our function deteriorates a little bit, we need to use every method we have to maintain better brain function and better brain health. So the diet is very important in brain health. Exercise and good health is very important. When it comes to hearing, it is also important because hearing is important to communication and to keeping your brain busy in listening and interacting, and it's helpful in cases of dementia, developing dementia, cognitive disorders, and so on.
So I have some hearing loss, and now I'm concerned that I'm going to have some brain tissue loss or some brain damage. What can I do to help with my hearing loss so that that doesn't happen to me?
Let me say that treating your hearing loss is not going to prevent cognitive disorders, and it's not going to prevent Alzheimer's or dementia. But if you do have a tendency to develop such disorders, or you are having them, then it is important to maintain your brain stimulated at all times. If you do not hear, you tend to withdraw, you tend not to communicate, and that withdrawal is going to allow your brain to become more and more, to degenerate more and more. So it is important, if you have hearing loss and if you are encountering such brain issues, to utilize hearing aids or any other sources of hearing help to prevent at least that part of your hearing, of your brain degeneration.
Well, good. I'm glad to hear that if I treat my hearing and I stay active, that can help stave off some of these degenerative diseases. Maybe not cure them, but keep them at bay a little bit. What other things can I do to keep some of this brain tissue loss, Alzheimer's, dementia, these diseases at bay?
Well, so far we do not have any final understanding of the cause of Alzheimer's disease. We know there are plaques in the brain, and we're looking to see how we could stop these from developing. So until we have a cure, we know that certain things must be done to delay the progression of the disease. And as I said earlier, a good diet, good exercise, maintain good health, good body weight, and keep your brain working. Puzzles, discussions, interactions with people, that's where the hearing comes in. With less interaction, you have less brain function and more likelihood for more degenerative changes.
Thank you, Doctor.
You're welcome.